Have a next speaker, Sourav Santra. Yeah. So he will be talking the bridging the gap autologous retinal transplant for refractory macular hole.
Hello. Good afternoon, everyone. This is a audio-visual video. Bridging the gap. Autologous retinal transplant for refractory macular hole, a single-step surgery. This is a patient that had failed standard macular hole surgery with ILM flap. This is a large macular hole of base diameter of 1656 micron. So we plan to do a autologous retinal transplant in this case. Pre-op vision was 6/60. At first, endolaser was done in circumferential manner in the superonasal quadrant from where retinal graft is to be harvested. Endocautery was applied along the inner margin of the lasered area. With the help of curved retinal scissors, multiple nicks were given to the cauterized area. Infusion pressure was slightly raised to reduce the bleeding. Before completely harvesting the neurosensory retinal graft, 80% circumferential cut was done, otherwise the flap may get lost. Then PFCL was injected up to the equator level. That will help you to control the retinal graft movement under PFCL. After completing the dissection with scissors, the retinal graft was raised with the help of forceps and dragged under PFCL towards the macular hole site and gently placed over the macular hole. Fine placement of graft was done so that it covers the macular hole nicely with a little rim on each side. More endolaser was done to the bleeding areas. PFCL air exchange is being done gradually and carefully away from the macular hole site so that the graft does not get aspirated out. Total PFCL removal was done and eye was closed under C3F8 tamponade with face down positioning for 10 days. At 3 weeks follow-up visit, there was a modest visual improvement from 6/60 to 6/24. On OCT, we could see the macular hole is closed with retinal graft nicely positioned, filling up the large macular hole. Thank you.
Thank you. Yeah, nice case, doctor. I just want to ask few questions. Was any laser done around the graft when you had placed?
No, around the macular
graft,
hole.
Graft, yes.
No,
They do laser.
No
okay,
laser.
and was the graft placed over the macular hole, or it was tucked inside the?
No, just placed above the hole, and no tucking was done.
You don't have any immediate first day post-op OCT?
The first of OCT there was some vitreous hemorrhage, so I don't have. This was a recently case.
Generally, even if you have gas, you can take an OCT and you can just say how is the first day the flap is. You don't have that.
The post-op OCT is there.
First post-op day. That's fine. Okay.
Okay, thank you.